So before we begin, I just want to remind everybody to remember it takes just a few minutes to fill out your census. It's fast, safe, and secure. I've already done mine, and um, I can't overstate how important it is to make sure all of us are counted, not just adults, but children, anybody who happens to be in your household, even if you have a cousin visiting. So the topic today is navigating the Colorado open enrollment process. In this crisis, so many folks are losing coverage and concerned about what to do next. And we thought, who better to keep us informed than our folks at Connect for Health Colorado. And I'm really pleased and honored today to introduce Kevin Patterson, who is the Chief Executive Officer for Connect for Health Colorado. Kevin, thank you so much for carving time out to chat with us this afternoon.
It's an honor to be here with you, Deidre. Thanks for inviting me.
So we will take some questions later, but we have some good ones just to start us off, because we know how important it is to get real timely information. So when you think about the macro view of things, what do you think is going to happen with regard to the Supreme Court decision, and is it still expected in June?
When I start talking about Supreme Court, expectation usually isn't part of my answer. This is the third big one that we've had in front of the Supreme Court. So, once you do it once or twice, you kind of get used to it. But this one is one that we are paying very close attention to. I think this one is a serious one. We've had a number of challenges from attacks on the Affordable Care Act for the last 9 years. And as we go through appeals, we're just trying to keep people focused on making sure we get them signed up and get everybody in as quickly and as efficiently as we can. So whatever happens with the Supreme Court, we're running a pretty successful exchange. We're stable, we're strong. We're just going to continue to move down until they tell us not to, because we've kind of been in this almost fear factor approach to it for a while. And what I tell my staff is we're just moving forward until they tell us not to. And I think, we're seeing a lot of results from that attitude, because we've been able to get a number of folks signed up even in this during the time of this pandemic. So, we've seen a number of laws passed even at the state level around pre-existing conditions and all kinds of things that I think are part of the Affordable Care Act. And so we think there are pieces of it that will survive no matter what happens. But, I don't want to get too far ahead of ourselves and worrying about something that we don't have to deal with right now, because there's enough for us to do today.
Definitely. So when is it likely that the Colorado option is going to happen, given this stay-at-home and now soon-to-be safer-at-home order?
It was really interesting. I mean, I've been in and out of that Capitol for my entire career in Colorado. And, seeing an actual stop during the legislative session was new, for me at least, and for a lot of folks that have been paying attention. I think it will be really key to see what they're able to pick up, because it's really going to be about budget and a few things I think they'll just have time to deal with. So I don't know if that will be part of the conversation or not. And when they come back in, was it May 18th? They've got the state budget due in June. It's not a lot of time to deal with a whole lot of other things. And so I think after they get the budget done, they'll start focusing in on other pieces of legislation. But I think it's really hard to say what they're going to pay attention to right now. We'll look at it as soon as we hear from them, and we'll make sure we're communicating what we hear out from people, because we've got our folks and our lobbyists down there to kind of keep an ear to what's going on. But I think it's going to be a tough one to see how that one fits in with such a limited amount of time, and with the dollars I think that are going to be left. It'll be interesting to see just how they get through the funding gap that they'll have to deal with.
Thank you. So right now we've got a special enrollment period. Is it likely that the COVID special enrollment period will be extended again?
We really did this because because we've extended it once. We had it going through the 3rd of April. And we were hearing from some folks because a lot of the early layoff notices were just getting to people like at the end of March, 1st of April. And folks were saying, folks only have a couple of days to really get the information, figure out what to do with their health insurance. And so we decided to go to the end of April. So you still have time to get in for this month. And right now, what we're really looking at is to see, one, we've signed up 10,000 people. So that was a number I was not expecting us to get to, especially this early. But I think we're seeing a number of people come in for the COVID related, because we wanted to make sure folks came in at the time that we were seeing the surge going up for hospitalization. So we wanted to make sure folks came in on that one. So there is another way that folks will be able to come in if they have a loss of job, loss of income. All those things still apply for them to come in for a 60-day special enrollment period once that particular action happens for them. So right now, I think we're not planning on it because we think there's other ways that people can get to us that will go even for longer than the special enrollment period that we've done, that was specifically about making sure people got covered for hospitalizations that we were seeing spiking up late March and into April.
Okay, so just trying to be proactive.
Yeah. And, we've got a lot of people that are out there making sure that we've got assistance to folks. So we've got our health coverage guys, we've got brokers, there's a number of things that they can do to call us, email us, and we can talk about that towards the end. But we want to make sure folks know that we're out there as a resource for the questions that they have, because there's a lot of them all at the same time.
So, and you spent so my next question was, how has enrollment changed since the special enrollment period was implemented? And you already mentioned that there was a significant number of folks. 10,000 is amazing, especially in that short time period.
Yeah, I mean, I think for the same period last year, we were at about 1,500 enrollments for this time period, and now we're over 10,000. So it's obviously something that was needed for us to see, and it's been a huge, huge opportunity for folks to come through. We have been able to partner, I think, too differently with the state of Colorado, because so many are coming in with unemployment at the same time. One of the things that we were trying to do is figure out how do we get to those folks, because normally you see a company might say, well, we're getting ready to downsize. We'd like to have somebody from Connect for Health come in and talk about what the options are, COBRA, individual market, Medicaid. We just kind of explain to people what the programs are from the state side to people. We can't get in front of all these folks for the sheer number and the stay-at-home order. And so what we were able to do is partner with the state, who was actually combining a number of their resources for folks that have been impacted at onwardco.org. And what they've created is a landing page for people to come in and for all the list of services, whether they're food, shelter, health insurance, job placement, all the things that the state is able to kind of put together. They've got it in one landing page. And so they were, I asked a silly question at a meeting of, can we get a link to some of this? And now we're like 2 clicks away from somebody that's looking for unemployment to get to the exchange. And that's not something that would have happened, I think, this quickly. And they did it in less than a week. So I have to be really appreciative of what, the state has been doing to partner to make sure that the citizen is getting to whatever he or she needs. And that's pretty significant for us to be able to get to folks directly and that quickly, because folks are just coming in and they're just asking the questions of, okay, if I can figure out rent, mortgage, and I can figure out how to make sure we've got food, I might want to think about that health insurance. And so it's been interesting to watch people kind of move that health insurance up to a higher priority of things because of this pandemic. And so we've been able to, I think, help folks that are out there now trying to figure out the individual market, because it's very different than employer-sponsored care. How to kind of meander through, I think, what is a very different way to purchase and shop for your own health insurance. And the other thing we've been doing is actually going to small businesses and making sure they understand what options they can give to their employees because a lot of these really small businesses, they become extended parts of the family for these business owners. And so they feel really bad that they have to make these kinds of reductions. And so we're trying to make sure that businesses understand that they can refer folks to us and we can help them shop to find something that is continuing the kind of care, whether it's a provider, a prescription, whatever it is that they're looking for. We have a lot of options that they might be able to continue their coverage with the provider that they like just by coming on the exchange and going through the eligibility process. They might be able to get financially assisted. And, about 3 out of 4 people are able to get financial assistance even through this time period.
That's fantastic. Because I think one of the things that's people want to know what's happening, but it's so good to hear about the work behind the work to put things in place.
Yeah, thanks. It's been one of those things you're just so busy trying to make sure you're connecting dots. You really have to tell people that you've connected the dots to try to make that easier because it's something new and different. But it also, I think, is a lot easier, and people wouldn't look for it because it wasn't there before. So we want to make sure that we're making those things available and known to the community as they're just trying to scurry around and figure out these big changes and transitions in their lives.
Wonderful. So and I'll ask you to give a little context. I know there are 2 different ways that folks who are unemployed have to account for their income and its effects. Can you talk a little bit about that for us?
Oh, yeah, this is a big one. So 3 different pieces of federal legislation. 2 of the 3 said, okay, for this unemployment benefit that you're getting, it doesn't count for income for Medicaid, and it doesn't count for income for the advanced premium tax credit, which is our side of the world. But that third one, the CARES Act, it split it and it's different. And so we've got 2 pieces of legislation that kind of bifurcating how eligibility is calculated for these folks. And they kind of did it real quickly in a system that we've already built. So it's something that all states and the FFM are trying to figure out how to handle, because I don't know that we're going to have an easy technology fix for this in the near future, because we're trying to figure out how to make that work. So we're getting better guidance from the feds. We're trying to make sure that we are clear on how we can walk people through. So what I just tell folks is, if you have a question, make sure you come and talk to any of our enrollment assisters. And so whether it's an enrollment assister, an enrollment center rather, that might have a broker and an assistance network guide, or if you're at a nonprofit organization that we've been partnering with before, and there's dozens of them around the state, make sure you're talking to somebody that can help figure out what your situation is, because it's really unique for different families. It really makes a difference to talk to somebody to kind of figure out what's going to work for you, because we look at income going forward. Medicaid looks at income going back in time. And so since we're literally in 2 different planes of existence, we're temporally in different places, it's really hard for a person to kind of figure that out when these pieces of legislation are written with different directions. And so rather than make the customer try to figure that out, we like, look, let us help you walk through that situation for you and your family, because there's so many questions we like to go through to make sure we're giving folks the right answer. It's not just a simple blanket answer. And, if it were, I'd be able to blast it out and that would be great. But I want to make sure folks are just really careful about that, because the last thing I want to do is say, well, here, let me help you pay for your health insurance, and then you end up with a tax bill. That is what I'm not trying to do. So I just want to make sure we're really careful about how we help people get through that particular question.
That's wonderful, because it's a lot to navigate, especially when you're in a crisis.
Exactly.
I think we put so much on folks not realizing it's difficult to navigate when things are fine, but when you're worried about family, income, and you suddenly have a new normal, it's even more difficult.
Right.
So, given the Onward, called onwardco.org, which is wonderful, we'll make sure we share that as well via social media. I think that's a great partnership. I guess a question for me, and it's just general.
Mm-hmm.
One of the nice things in talking to different departments and organizations is that people are finding new ways to remove barriers and get things to people. Do you think we'll be able to, or do you think it's likely that some of these new ways will live on once we're past this crisis, to really keep barriers streamlined?
No doubt. I mean, even this kind of conversation was something that, I've done a few of these Facebook Lives, but, not a whole bunch of them. I think I've done one with Brother Jeff. I'm glad to do this with you. We've tried to figure out podcasting, other ways that the technology really helps us reach a much broader audience that we wouldn't get to in more traditional ways. I think that will be helpful. One of the things that we were able to do as the exchange is we were able to go 100% virtual. It took us a few days because we just had to get equipment in and work out a few bugs because it was all wired and working for our system in the office. And so we had to start working it in everybody's house. But we've been able to find ways to reach out to more folks internally and externally, more places around the state. So now I have a couple of employees that are on the Western Slope that I can see every 2 weeks much more easily now, because we're able to do these Zooms and Ring Centrals and all these other ways of kind of getting people together. And, we're not limited by the space of our facility on who can participate. And so, I've seen our own staff meetings go to like 150 folks because we've got our staff, our vendors, people that are just interested that are helping us along the way. So it's still an internal audience, but it's a way those 150 people couldn't be in that same room if we were literally in our physical facility. And so we're looking at ways that we can branch out and be in more locations across the state, ways that we can have talent from all over the state and all over the country, just different things that I think will allow us to be much more real time and inclusive in our approach. And, we've done our first board meeting, virtually. And one thing we notice is our meetings are actually shorter. So they're really efficient because we're able to, if you share your screen, you're able to get everybody's attention on one thing. It really does focus the conversation. So I think there's just a lot of things that we're trying to figure out. There's this great technology we've been carrying around, but maybe we've not been using it to its fullest extent. And I think we are really excited about opportunities where we can be in more places as an organization, because we do have that statewide approach.
That's fantastic. We're doing the same thing. Our board meeting is going to be online via Zoom next week, as well as looking at things that were traditional in-person classes. How can they really be virtual? So do you have any advice for not only families that might be concerned or businesses, but just in general, kind of navigating coverage?
Oh, such a big question. It depends. I mean, I think one, you can't be afraid to ask a question, because there are no stupid questions in health insurance. It's just that complicated. And, the way I was explaining it, I've been in this organization now almost 5 years to the day. And as I was leaving the governor's office, I was explaining to one of my then former colleagues, he's like, I'm trying to understand exactly what is it that you do, Kevin? I mean, I kind of get you do the tax credit thing, but I don't understand how that all works. And I said, well, I have a shopping platform that people are picking their health insurance. And I said, but here's the difference. At the state, you have two health insurance companies that offer two plans. So you've got four choices that you're trying to manage for state employees. At that time, I had 125 choices that I'm trying to manage over what then were seven insurance companies. And now we're 8 insurance companies and 140 choices. And he was like, oh, that is different. And I said, yeah, but we're expecting people to do this with no HR department. And, sometimes more choice just gets overwhelming. And it's such an important decision for families to make that they should be reaching out and getting, some assistance. And, some folks are like, well, I don't understand how the brokers work, but, some businesses, they're used to that. So they're used to having some sort of assistance that way. And so we're like, okay, we do it in nonprofits through CBOs to do it with our assistance network. And if you just get sick and you go to the hospital, we've got certified application centers. So there are some hospitals and providers that will do some of this work to help make sure people are able to help shoulder the burden for these costs that they have. And so it's never a bad time to ask a question, and none of the questions are stupid. So I just encourage people to reach out and use this as a research, whether you're on the exchange or not. I mean, if you're on it, that's great. But if you're not, just come check us out, see if you learn something to understand how to make a better choice for you and your family. That's what's most important to me.
That's fantastic. So, there are a lot of warnings going out around COVID, beware of this. We've been sending information to some seniors. Is there anything around coverage that we need to make sure folks realize, ignore that?
Yeah, we've seen some ne'er-do-wells, I guess is the best term I can use in the public setting, that are kind of scamming people and scaring people into some sort of COVID kind of coverage. And we just want to make sure that folks understand that we are the official marketplace for people that are trying to get their tax credit. If you want to buy direct with your carrier, we can do that part too. It's just a few questions we'll ask, and then we kind of get you set up. If you want to go through a broker, we're fine with that. We're really agnostic. Our point is to make sure folks get coverage and you're getting good advice. So that's why I tell people, look at our website. We have chat that's available if you want to do it that way. If you want to call and talk to one of our call center agents, we can help people through very simple questions to complex households where, the adult is on the tax credit and the kid is on child health plan. And because just the way the eligibility numbers work, that happens in a lot of our families. And so, that's still, I think, one of the trickiest things that we see is these two different eligibilities in the same household. So we have an actual team of people in my organization that their specialty is to deal with that. So they can see into the state CBMS, the benefit system, they can see our side and they can manage that household in a way that takes a lot of worry off families so they can make the right choices. And so for me, it's not we're not competing with Medicaid. It's a complementary service. We want to make sure folks understand that that's our approach. So we'll make sure that we explain in a way where the family can make the decision that they're the most comfortable with, because that's the best way to treat their customer.
Okay, so you really are a one-stop for all coverage information a family or individual might need.
Yeah, that's really our push. It's funny because in 2008, the state had that Blue Ribbon Commission report that started with Owens, went to Ritter, and then Hickenlooper signed it as governor. But it had this idea of a connector, one place for the individual market, and that's really the role that we are building ourselves to finally take on. I mean, we had a lot of challenges, I think, as an organization, just starting the Affordable Care Act, but we've worked out a number of those bugs. Not that everything's perfect, but we're in a much better place than we were 5 years ago. And now we're starting to think about, well, what other things can we help people with that we can leverage the platform that we've built and a lot of the customer input that we hear over the years to say, well, maybe if we kind of displayed it this way. Like one thing we did last year is we completely revamped our website. First time we've done it since our initial offering. And we did a lot of work on human-centric design where we actually asked customers,
Okay.
what's the way you want to look at this information? This is what we think makes sense. What makes sense to you? And so I think we've made some huge improvements. So you're not just overwhelmed by the information at first. It's like, let's start with 3 to 5 questions. Well, my rule is handful, never more than 5 things, because people just can't get through all that information. 3 is better. And so we try to keep things as simple until and then let people ask more questions or provide more answers so they can walk into the place where they're comfortable. And it's not like you got to answer everything all at once. We're going to give them 50 questions. So I just don't think that's the right approach.
Right, you can really tailor it to what people need.
Right.
So along those lines, can you address like what some of the financial assistance options are?
Sure.
Through Metro?
Sure. So I think the easiest way to look at this is if you're around $15, $16 an hour as an employee and you're working full time, you not only get the tax credit, which can pay up to, let's say you've got a $750 a month premium because you've picked this plan and you've got to go to the doctor a lot. And a lot of those plans, you can get that down to $150 or so a month. And if you're at that lower end of the cost, the lower end of the federal poverty level, they also have a cost share reduction where they actually help you pay some of the out of pocket. So it'll help pay for co-pays and some of the smaller doctor office visit numbers that make it more accessible for you to get there. And so we've seen some households have like either $0 premiums for some of their care, $5 to $10 amount a month in some families, or $100, $150. Now, as you make more money, you end up having to share a little bit more cost there, but we're able to provide what on average is about $350 a month of financial assistance for Coloradans. Some it's more, some it's less. I mean, on the Western Slope, it's been as high as $700 a month for a lot of families. So it's real money.
Okay, that's wonderful. Well, we're getting close to the end of our half hour. Thank you so much for joining us. I have one more question for you.
Sure.
Have you filled out your census?
I did. I did it
Wonderful.
quickly. I did it early. I may have done it last month. I can't figure out. It's like dog years because I'm kind of out of my, routine element. But I remember getting the letter, and I said, "Well, I'm going online because I don't want to mess with it. I want to hurry up and get it done." So I actually did it the same day I got the envelope. So I encourage everybody to hurry up and fill those things out. It's really, really important.
Again, thank you so much. I'd love to have you come back because we're going to really keep doing this on a weekly basis, probably from now on, because this is going to be important for us to make sure we navigate. Let's see, what else did I want to say?
Can I throw one thing in before
please do.
we're done? One, it's been an honor to be here. So anytime I can make something work to talk to you and your clientele, I'm always happy to do that. It's an important conversation for us to keep in front of the community. Couple things I just want to make sure that folks know. If you want to call us, our phone number is 855-PLANS-4U. That's 855-752-6749. And if you go in on the website, it's connectforhealthco.com. You can click under the Contact Us button, and you can do the live chat. There's a spot to send us an email to our box. You can get to the customer service center. We've got different ways for folks to come in. So if you don't want to talk to anybody on the phone, that's okay. We've got a couple of other ways to make sure that we can get the information to you in the way that works for you and your schedule.
Awesome. And then there's also the new onwardcolorado.org.
Onwardco.org. It's really, it's kind of cool. It really is.
Thank you. Great information. Thank you so much for what you do. I remember when the exchange was first coming up. So thank you.
No problem.
It's a heavy lift.
Thank you so much.
So again, everybody, thank you for joining us on this Facebook Live. We plan on having weekly, timely, relevant discussions to help us all navigate this crisis. If you haven't already signed up, please visit our website at www.caahealth.org for our newsletter and to learn more about how to respond to COVID, community programs, and health and wellness tips. I actually am going to be on Colorado Matters next Wednesday morning with Representative Leslie Herod and Dr. Renee Marquant from CDHS talking about our community and what's at stake with regard to COVID-19. So please join us. And again, stay safe, be careful, and we look forward to talking to you soon. We're also doing our best to be as responsive to questions that we receive. So feel free to email us or call. Take care.